Welcome to Around the Empire. I'm your host, Joanne Leon, Around the Empire podcast, listener-supported independent media. Please pitch in if you can, patreon.com/aroundtheempire or paypal.me/aroundtheempirepod. Also, please like, share, and subscribe on the YouTube channel, youtube.com/aroundtheempire. Dr. Bob Gill joins us today from the UK, and we discuss his documentary titled The Great NHS Heist, wherein Dr. Gill, a general practitioner within the NHS system, and others, talk about the imminent threat to and the covert destruction of the English National Health Service. We also talk about what we in the UK and in the US can do to better understand the situation, inform our peers about our respective situations in healthcare. To quote from a bit of the abstract from the film on its website, quote, "We witness the new corporate managerialism and marketisation of healthcare, shrinkage of the NHS bed capacity, and transfers of assets into the private sector using the Private Finance Initiative and NHS land sales. Private operators expanding their grip on the NHS, securing contracts for the provision of ancillary and then clinical services, rapidly accelerated by the 2012 Health and Social Care Act. The privatisation lobby crafted effective cover stories and carefully managed the national debate to maintain public ignorance and remained largely unchallenged by compliant mainstream media. Successive reforms were presented as essential improvements while disguising the reality of creeping privatisation. The stage was set for the heist of the NHS land, patient medical data, and £120 billion annual tax-funded budget for U.S. corporate raiders. We recorded this on December 8th, 2019. Dr. Bob Gill is here talking to us from the UK. Hi, Dr. Bob. Thanks so much for coming on the show. It's great to meet you.
Hi, Joanne. It's my pleasure. Thanks for inviting me on.
So we were introduced by a mutual friend who showed me this documentary that you have done. It's called The Great NHS Heist, and I just watched it. This is a particularly important issue to both the UK and the US right now. We're fighting really hard to get Medicare for all, to improve our overall situation, to fight back against these giant corporations, because we've already been through this, in 2008. The country was already sold on. This is not a new issue for us. We've been trying to get better health care for a long time now. We were sold out by the Obama administration at a point in time when they had a great giant mandate. They controlled the White House, the House, and the Senate. And instead, they caved to the large lobbies, which are the insurance industry, the hospital industry, and the pharmaceutical industry. And they made sure that we couldn't even get a public option, what they call, which is, the ability to get into something like a Medicare government-administrated healthcare program. So we couldn't even do that. It's only gotten worse since then. And even now we have a Republican administration and a large majority of the country. Well, first of all, voters consistently say that healthcare is the top issue in this country, and there's a lot of support for a Medicare for all type option. That's just how bad it's gotten. Now, in your case, of course, you had an NHS system. You had a government funded and government run healthcare system since post World War II. My partner was born and raised in Britain, and he told, so I knew about your NHS system. He, talked about a point in time when his mother had 3 children. They didn't have a car. They grew up outside of London in the Grays area. And the doctor would come to the house. She didn't even have to take the kids. The kids didn't get sick that often, but when they did, she could get the care that they needed. And it was just never an issue. They just didn't even think about it. Which is totally different from what's going on here. But now both countries are, in my view, the victim of the same corporate greed. And if you would, tell us a little about yourself and then how you got into this, and then let's talk some more about the documentary.
Sure. So I'm a general practitioner, or you might call it a family doctor in America, and I've been qualified since 1993, so over 25 years as a doctor. And I took the NHS for granted up until a few years ago. The NHS, as you describe, is publicly funded through taxation and is publicly provided. But it was only when I started to see the signs of government policy taking us in the wrong direction that I started to slowly wake up. Now, in 2007, I watched Sicko by Michael Moore,
Right.
which is an expose of the not the people without insurance, but the people with insurance in America and how they get ripped off and let down by their insurer. Now, at that point, I just put my hand on my heart and I said, thank God we don't live in a system like that. But little did I know that our consecutive governments have been undermining the NHS for at least 3 decades by stealth to get us to the current point where it has been parceled up and repurposed, ready for corporate capture. And that's where we are at the moment. So it's been a very steep learning curve for me, not only to do the day job, but to find out and get my head around health policy and what government is up to. But my personal journey, going from a doctor to a campaigner to be, making a film about it all, started around 2012, when we had already suffered the downgrading of a local hospital, local community hospital, and the government were proposing to close down another hospital up the road. And I thought this would be catastrophic for my patients. And it was at that time I thought, I need to become active. I can't just sit quietly in my consulting room and, get frustrated and keep my mouth shut. I needed to do something. And it was clear to me that the local doctors who are supposedly representing the interests of doctors and patients were willing to sit on their hands. And that was the motivation.
Right. And now you are still a practicing doctor within the system?
I am, yes. I'm still a family doctor, and it's getting tougher and tougher. And
Yeah.
we're seeing the consequences of the deliberate defunding. So, just to quote or paraphrase Noam Chomsky, how do you privatize? You defund, you get people angry, and then you hand it over to private capital. Since 2010 until the present day, we've had the defunding stage, where the government has deliberately withheld funding from the NHS to drive down standards, to push it to the point of crisis, such that the public and the professionals lose faith with the NHS. So it's quite a cynical, deliberate manipulation of what's going on with the NHS. And it's costing lives. So we know research has shown that an estimated 130,000 people have died preventably prematurely due to cuts in the NHS and social care budgets. We know that life expectancy in this country has dropped by 6 months for people over the age of 65. And what is worst of all, we've seen a rise in infant mortality for 3 years in a row. And that's the first time that has been observed since records began outside of wartime. So in effect, you have a government which is instigating policy which is killing the sick and the poor. And there's nothing about it on the news.
No, there's not. And in fact, as I was telling you earlier, here there's been a long campaign through corporate media, which gets a lot of ad revenue from the various health-related industries that I mentioned earlier. And we are constantly told that the Canadian healthcare system is terrible. You have to wait really long to get care and surgery, and that Canadians are coming over the border here to America because America has the best healthcare in the world. The UK system is demonized even more because it's painted as the word socialist has become even if we're only talking about a socialist program within a very hyper capitalist system, it's very much demonized. And so yours is even we don't talk about it that much, but whenever it is referenced here, the establishment will try to undermine it. But they will boost the stories, the disaster stories, the
Sure.
negative stories, which, as you say, the system. This is a long game that they're playing, and you show that by showing that this began on your side of the pond, began under Thatcher and Reagan, which so many bad things started. And over here, it started under Nixon. You pulled out some Richard Nixon tapes talking about Kaiser Permanente. I didn't know any of that. It's a really good documentary, everybody. I really recommend that you watch this.
Well, I owe that bit of tape. The source of that, the idea for that came from Michael Moore's film Sicko. He exposed the origins of the HMO, the Health Maintenance Organization, during the Nixon administration. The key line was, the less care you give them, that is patients, the more money you make, that is the providers and the insurers. So you have a system in America which is designed by the corporations for the interest of the corporations.
Now, on Twitter, I just saw and forgive me, I don't remember who made this, but it was a short video, man on the street interview. And someone was talking to some people in the UK and asking them, how much do they think it costs to have a baby, for example? How much does it cost for, I forget, various treatments? And the person interviews these people in the street and they guess at, how much it costs. And then he tells them how much it really costs. And they are genuinely shocked. So it seemed, I thought our healthcare system was kind of infamous, but it seems like a lot of people really do not know what it's like.
Well, the key thing to mention is that there is a propaganda war. So mainstream media in this country makes sure that we don't hear the horror stories from America, that we don't understand how toxic and dysfunctional the American healthcare system is. So we are kept ignorant of how bad things are over there. Meanwhile, you are subjected to lies and deception about other healthcare systems like Canada, like the UK. But fundamentally, the basics, let me boil it down for you. You can either pay things through taxation, for which you already have an established bureaucracy, and you can implement it through public provision, as you do with the police service, as you do with the fire service, as you do with the military. And you can replicate that in healthcare, and you can cut out all the middlemen, and you can cut out huge swathes of bureaucracy, and you can remove the perverse incentives to generate profit away from patient care. Now, what is wrong with a system like that? So the lines that the insurance industry and the healthcare industry over there have to come up with have to reinforce prejudice that already exists. To call something socialized is almost a term of of contempt. The reality is, the beauty of our system, I only appreciate now that we're on the brink of losing it, is that whatever I advise is good for my patients. I have no perverse incentive, no cash incentive to be telling them any different. But the system we're going to, I will be incentivized to tell them the wrong thing. I will be incentivized to say, well, you don't need this operation, because my bonus will depend on withholding their care. And at that point, the trust in the UK health professionals will nosedive.
Wow. Okay. So is that system in place, or is that something that is that a law that they're passing? Like, where are you at the point? What changes have happened to the NHS system? If you could sort of lay that out, how it has progressed.
Well, if you think of healthcare as three asset groups, let's think of it as the stock exchange and the sort of City of London think about healthcare. They look at it as a series of assets. They're not interested in delivering health outcomes for patients. And the assets you can boil it down into is the land and the property, the patient data, and the government budgets.
All right.
Okay, so that's what the film tries to do, is to break it down into these asset groups. Now, in the 2000s, the land was prepared for corporate asset stripping by the imposition of odious debt called private finance initiative. Okay, so the
Mm-hmm.
government borrowed from private institutions at extortionate interest rates, when government can borrow cheaper than anybody else, to build new hospitals. And what this did, not only it saddled the NHS with debt, but it transfers the ownership of the asset to these private entities. And the debt was scheduled to rise and rise over the course of the agreement, to become more and more onerous, and that debt servicing would be the excuse to flog off what the public owned and had no debt. So now you have a financialization and a plausible narrative to asset strip the very fabric of the NHS. So that's the land and the assets. The second thing is the patient data. So the NHS is considered one of the richest data sets in the world. We've had a unified system, collection of data in a consistent manner since 1948. Now, can you imagine what a treasure trove that is to these big IT companies?
Yeah, yeah.
Only today there was a story in the Times that revealed the government had given away access to this data to Amazon.
Oh my gosh.
Not even sold it. It's given this data away free of charge to a huge company which is known to be a tax dodging corporation. So you have a fleecing of the nation. You have, not only you're giving away your assets, they don't even contribute to the tax take. So you're getting ripped off twice.
Oh,
So so that's the data, okay? And the final element is the budget. Now, who wants their hands on the budget flows? The insurance companies. United Health Group in particular, they have their man at the top of the NHS. You couldn't make this up. The former president for global expansion, a Mr. Simon Stevens, is in charge of the NHS in England. And he is busily putting in structural changes which will put United Health and their subsidiary Optum in the key position in the money flow. The equivalent for you might be the insurers operating Medicare and Medicaid.
okay.
Okay, so the government doesn't allocate the funding, it goes through an insurer to distribute the funding. And that's what's happening at the moment. So we have an insurance insider leading the NHS and remodeling the financial structures of the NHS along the lines of Medicare, Medicaid, and the insurance system in America. And nobody knows about this in this country.
Now, the financing of the hospitals, is this, we have things over here that we call a public-private operation or public-private project. And the way it always seems to turn out is that the profits are privatized and the losses are socialized. That
Yeah,
seems to be how it goes.
it,
Uh,
it's a bit like feeding a patient a whole series of tapeworms.
oh, yeah, you
Okay,
did use that
you
example.
put
Yeah.
these tapeworms in the stomach, and you say, well, the only solution to keep the patient alive is to feed these tapeworms.
Oh my gosh.
Well, why not eradicate the tapeworms? And it is those parasites that in the US dominate policy, and in the UK are having increasing sway. Our politicians on both sides of the pond are in the pockets of these corporations, and they need the media to spin the lines to keep the public off the scent. But the reality is, neither country is resembling a democracy where you have a free and independent press scrutinizing policymakers, and where you have money out of politics. Well, in America, it's obscene, but in this country, you don't buy senators. What you do is you use a revolving door. So you get politicians as they come out of parliament onto the boards of these corporations that are cashing up from our health service.
Yeah, we've got that part here too, but it sounds like we're a little bit more advanced in the legalization of bribery, which is another.
Yes.
Yeah, and this is not related. Well, I mean, it's sort of related, but the whole issue of privatizing. I think one of the most stark examples where we could actually see what was happening is with Greece. When Greece went through they were going to leave the EU, and Yanis Varoufakis, who I noticed was in your documentary as well. Just a really tiny example here. So after Greece caved to the agreement with the EU, which they didn't seem to have any choice, what happened then was the selling off of assets in Greece. And what I heard is that basically what happened was they cherry picked ports and airports and other public assets, but they only privatized the profitable ones. The ones that lost money, they still left those with the government. So again, it's this, like you said, it's like a tapeworm. It's this privatization is such a scam. You know, you can see that happening in a lot of different places, but that one, because it's a small country and it was a well observed situation, we saw the game there.
Yeah, it became pretty blatant what was going on. So, you know, we have a system which is not even capitalism. This is crony capitalism. It's where the state guarantees the profits of huge corporations. Now, in true capitalism, corporations will either thrive or they will fail and they'll be allowed to go to the wall. But that has gone. We now have a system, we found out in 2008 with the banking crash, where the taxpayer is on the hook for the failure of these private corporations. So we have turned into a huge social security fund for multinational corporations and banks.
That's right. And we won't go into it in this interview here, but the military is being used for those purposes too. So, you know, for our friends who are libertarians or conservatives who are, you know, really skeptical of big government, and for good reason, there's plenty of reasons to, um, you know, to be skeptical about these things. This is not a free market system, and we can show you lots of examples why. But you know, healthcare, it can't be run by the head of United Health, though. You know, the a socialized healthcare system with a guy at the top of it who is, you know, one of the biggest insurance companies, one of the culprits. I mean, first, I guess you got to get him out of there. But politically, Dr. Bob, what are you trying to achieve in the UK? What are the next steps, and what are for Americans? It's clear we need to pay attention to the systems in these other countries. We need to realize that we're being propagandized about it. But in the UK, you have an election coming up next week. The answer seems kind of obvious, but you know, what are you thinking politically are the next steps, and what are the things that people can do? Because we're up against a very big system here. It's overwhelming. It's scary. What are some things that people can do to advance in some way?
I think fundamentally the foundation has to be knowledge. So your program, my film, is seeking to improve the level of understanding and knowledge of the population. If you are ignorant, then you're going to be scammed.
Right.
Markets do not work in healthcare because it's a natural monopoly. Let me explain why. Number one, information asymmetry. If you are working in a market, you have a consumer who wants to buy a good. Well, the consumer has to have some way of assessing whether what he is buying is value for money. Now, when you have a doctor-patient relationship, you cannot. This is not two equals. The doctor will always know more about what he is selling than the patient. So you cannot have a market exchange. The patient is ill-equipped. So that's number one. You cannot exercise market power when you have such gross asymmetry of knowledge. The second thing is you are not going to be able to exhibit choice if you are critically ill. If you get run over by a truck, you're not going to go on the internet and look for which intensive care unit you want to go to.
Yes, right.
You're unconscious. You're close to death. So a market system is a complete failure in healthcare. The best example of a market system failing is the American system. It's because of market failure you have Medicaid and you have Medicare, because the privatized system perversely doesn't want to look after the sick and doesn't want to look after the poor. Well, what's the point of a system like that if it's consciously avoiding sick people? You couldn't make it up.
Yeah.
So natural monopolies, there is no place for market fundamentalism. Water is another natural monopoly. You do not. Why would you introduce a private element to the supply of utilities? It's crazy. We have been sold a constant stream of lies, which took hold back in the 70s when you had this Reagan-Thatcher nexus, the free market ideology, neoliberalism about privatizing, deregulating, and lower taxes. Well, look where that got us. It got us to 2008, and you've got this gross inequality of billionaires paying hardly any tax, and the average man on the street getting taxed and crucified and having to take out payday loans just to survive.
And guilted for it, by the way. You touch on that a little bit in your documentary about how, well, here the poor are made to believe that it's their own fault. Uh, any kind of structural disadvantage is just wiped out. You just didn't work hard enough. You didn't try hard enough. In the healthcare system, it's the same thing. Oh, you didn't eat properly, or you didn't, or you drank, or you smoked, or something, and that's all your fault. So that's a big part of it too, psychologically, is to make people blame themselves.
Blame
Uh,
themselves and also break down social solidarity. So
oh yeah,
if we are continually resenting each other at the bottom, well, I don't like that guy because he's overweight. Oh, I don't like that guy because he's an immigrant. Or I don't like that guy because he's on welfare. We spend all our time and energy disrespecting and fighting amongst ourselves at the bottom. Meanwhile, everybody's pocket is getting picked at the top. So divide and rule is essential. And the narrative about blaming the patient is also key. So they will blame lifestyle choices, they will blame, you name it, they will blame the disease on the patient, and to lose that social solidarity. That's what's going on. And again, it's another key propaganda arm to their strategy. Divide and rule.
that is really really important. I'm glad that we talked about this, because in the talk that I saw, I watched the documentary. I also watched a talk that you gave last February, and then you did a long Q&A. And I think toward the end of it, one of the last messages that you sent was, we really need to resist this. We need to snap out of it, stop this partisan bickering. It's more than bickering here. It's quite scary, the amount of hate that's developing among different political parties, different political ideologies, different ethnicities. Any progress that we had made before, I think we're losing ground. And that might be the number one thing. That might be
Well,
the number one thing that we need to do, is stop, fighting among ourselves and realize who the real enemy is.
I think you're spot on. This sort of identity politics is all a distraction. The elites that control how the world is working know that they need to keep us divided and confused. That's their number one strategy. But the reality is, unless we unify, unless we realize that certain things, if done collectively, are for the common good, that is the way to go. The other point you remind me of is the system we had and are trying to restore in aligned incentives. Yeah. So the incentive for the healthcare professional was also in line with what's best for the patient. In a privatized system, those incentives are misaligned. So you make the incentive for the healthcare provider to act against the interests of the patient. Now, not only do you harm and kill patients in that system, but you destroy the soul of the healthcare provider.
Mm.
This is a psychological torture to people with a conscience, to people with ethics. So you drive those people out of the system, or you break them. So not only are the victims the patient, clearly they're the victims of this, but the other victims are the health professionals stuck in a dysfunctional, profit, greedy, corporate-dominated system.
Yeah, yeah. And again, I recommend people watch the documentary because you cover that. You cover that well, and because you've had to resist that once you sort of became woke, if you will, of this. You constantly have to resist that mindset yourself.
Exactly. There are, they do it gradually. The incentives creep in for us to reach certain targets. Otherwise, we might lose out on a payment. Well, if reaching those targets depends on restricting care for my patients, I'm not interested. But you have to have that insight in terms of what's going on. What are we being conditioned to? What is being normalized here? And it's taken decades to get us to where we are.
Yeah, I know that this is sort of anecdotal, but what I'm hearing is that, and I actually have heard this from one doctor myself, doctors here are, for example, they're not advising their children to go into the field. And they're actually discouraging other people from going into the field because they're so frustrated. So, just so you know that.
No, it's definitely happening. My son wants to follow in my footsteps, and that's despite seeing everything I get up to with campaigning and all the rest of it and the trouble we're having. He still wants to go into medicine for all the right reasons. But I think that's a bit of a cop-out. The health professionals, particularly the doctors in the States, have been relatively quiet about all of this. I think the nurses, particularly the California Nurses Association, are far more vocal about the damage that is happening to patients in the States. Over here, generally, if you look at the background of doctors, they tend to be small c conservative. They come from middle class families. They tend to do everything teacher told them. They hand their homework in time. They are not radical people, but they need to become radical because they are getting broken. And the key thing that they will lose once the respect goes and the trust goes between the doctor and the patient, well, what's left? What is left? This is not medicine anymore.
Right. And as far as politics go, I used to think that the political parties and the political system in the UK and the US were so entirely different, there were no comparisons. But over the last 5 to 10 years, I'm noticing more and more in common. The political parties are both very difficult to support. Over here, they're, I think, both really completely corrupted because the Democratic Party is a neoliberal party. We're trying really hard to change that. I go back and forth between just abandoning that party altogether and saying it's not reformable. We need a new party. The Labor Party, how you had Tony Blair during almost the same era being, in my view, corrupted, and yet you have your Jeremy Corbyn and we have our Bernie Sanders. It might be savable. I hope it is, but it's not like you can just cling to one party either to fix this. It's not like you can just, live your life, which is hard enough to get by as it is. You can't just sort of like, okay, well, I know if I vote for this party, everything will be okay. So where do you see that going? A lot seems to hinge on this upcoming election.
I think it's very easy to get hung up on voting. See your democratic duty as a citizen as voting every few years and doing nothing else. You certainly should vote. You certainly should vote for whoever's, at least talking about the right things in society, such as climate change, such as access to healthcare, such as a fair taxation system. So Bernie Sanders in America and Jeremy Corbyn in this country they have the right narrative now. The problem they have is their party bureaucracies, which, as you say, are still tied to the neoliberal way of thinking. So they will need our support if ever they get elected is to make sure that the promises are carried out. And it's only an informed and active population that can do that. So vote by all means, but don't think that's your responsibility over, because otherwise, unless a significant critical mass of the public become actively politically engaged on a regular basis, then we're not going to get anywhere. We're not going to win this fight. We need to provide genuine political voices with the grassroots support that they need to strengthen them. Otherwise, they'll get taken down by their party bureaucracies.
Right. And none of that happens unless people are well informed, or at least, somewhat well informed. And you and I, as individuals, we're up against a big system, but we can do what we're doing right now. At least for now, we can. And so before we wrap up, I just want to make sure that you tell everyone where to find your work, how to support your work. All these links will also be in the show notes. And any other message that you want to send out before we wrap up, please take the floor.
So our website is thegreatnhsheist.com, and we're on Facebook and Twitter, The Great NHS Heist. We've also put up a link to our documentary, which we've made freely available in the run-up to the election, hoping that people will watch it and help them see through the lies that are being spun, particularly by Boris Johnson, about how the NHS is safe in his hands. So spread the word. I think we need to form strong bonds between health campaigners in America and health campaigners in England to not only help you reform your toxic system, but to stop us falling into the same trap. So we need to build those links. And, good luck with what you're doing there. And hopefully people who are listening to this will realize that, corporate media is doing a job, and their job is to keep the public in the dark. And we need to smash through that darkness, shine a light on the darkness.
Couldn't say it better myself. Thank you so much. It was great to meet you, and I wish you the best of luck in the work that you're doing. And please come back again, give us some updates, tell us some more. And it was really great to meet you. Thank you so much.
Thank you, Joanna.
Thank you for listening. Special thanks to Dr. Bob Gill. Follow him on Twitter at Dr. Bob Gill, Gill. Find all the information on this film at the website, thegreatnhsheist.com. Subscribe to their YouTube channel and support their work at their GoFundMe. And all these links are in the show notes. The Around the Empire podcast, independent media. Your support, really important. Please pitch in if you can, patreon.com/aroundtheempire, paypal.me/aroundtheempirepod. You can find the podcast in many places, lots of ways to listen to it. Find it on any mobile podcast app, or on the website, aroundtheempire.com, on Patreon, or on YouTube, youtube.com/aroundtheempire. And if you're listening on YouTube, don't forget to like, share, subscribe. Follow on Twitter at Around the Empire, and we'll see you next time. Take care, everyone.